Thank you for your patience. We are starting in 10 minutes. Please keep sitting with us. Thank you.
ಅವನ ಬೇರೆನ ಮಾತಾಡಿದೆ షూస్ వచ్చినాయి ఏది రిటర్న్ పోయినాయి రిటర్న్ పైసలు ఇవాళ నైట్ టైం పోతా ఆడికి ఇంటికి ఇంటికి వాటి 2 days వెళ్ళా బట్టలు తీసుకెళ్ళా ఎన్నో వడ్డీ అని పోతా ఆల్ గైస్ టు దిస్ ఇస్ ఆడికొద్దు నేను అది తెప్పిస్తా పొడి మానేస్తా అంతే కదా 4 లక్షలు వస్తా అంతే 4 లక్షలు వస్తా అది షూటింగ్ డిప్లై రేపటి డేట్ అయిపోయింది రేపటికి అయిపోయింది ఎప్పుడు నువ్వు రేపు నైటా నైట్ ఇది రేపు 4 కెమెరాలు ఏం పని ఉంది మొన్న వస్తుంది అన్ని చెప్పులు లైట్ వేసుకుందామని ఎక్కువ ఫోకస్ పెట్టి తొందరగా వేసుకో నాయన ఆఫ్ చేయకండి స్విచ్ ఆఫ్ చేసి పెట్టి ఆఫ్ చేసి పెట్టి బ్యాటరీ పెట్టినా అదే 1 2 3 4 చార్జర్ మర్చిపోయి ఏమా మనం చెప్పుకోవటం చూడాలి
Piyush Goyal. Paridi. Please settle down. Distinguished guests, ladies and gentlemen, very good evening to you all. We have the unique privilege today of being in the company of visionary leaders and global industry captains. I would like to extend a warm welcome to the Honorable Union Minister for Commerce and Industry, Shri Piyush Goyal ji, and Honorable Minister for Industries and Commerce, Shri KT Rama Rao. It is indeed a privilege that Dr. Vas Narasimhan, CEO of Novartis, could join us today at BioAsia. In times of change and transition for the life sciences industry, Vas is leading from the front with his vision to reimagine medicine and deliver innovative drugs to the world. He has for long been a staunch supporter and an ambassador for the Hyderabad ecosystem as well. Welcome, Vas. We would like to kickstart the evening with a presentation of prestigious Genome Valley Excellence Award to Dr. Vas Narasimhan in recognition of his remarkable contributions to the global healthcare. Before presentation ceremony, can we please have the AV now? May I now request Honorable Ministers to kindly come on the dais and present Dr. Narasimhan with the prestigious award. Thank you, Honorable Ministers. Now, I hand over the floor to Vas for his keynote address.
So thank you, and thank you all very much, and really honored by both ministers. Thank you for the incredible award. I think having this award here in India, of course, the birthplace of my parents, grandparents, an incredible honor to have the Genome Valley Excellence Award bestowed upon me. And I'm looking forward to just sharing a few perspectives I have on reimagining medicine, some of the big trends that I see shaping this industry, and then look forward to the dialogue with the distinguished panel of CEOs. I did want to begin with a reflection, because I, of course, stand on the shoulders of giants in order to even be on this stage. My grandparents came from Tirupati, and of course, the state of Andhra Pradesh. You can see here my grandmother and grandfather, the only pictures I could find of them. Both, of course, coming from India, working very hard to give my parents the opportunity to eventually make it to the United States. This is a picture of my grandfather as he graduated from Delhi University in pharmacology. One of the most remarkable stories of my journey is shortly after graduating, he went to Pune to work in the pharmaceutical firms that were developing there. And he was given an internship to actually go to Basel to Ciba Geigy, which of course would later become Novartis, the company I stand here as CEO of. So we stand on the shoulder of giants. I'm humbled by the fact I'm here, and I'm grateful for the incredible sacrifices that all of them made to enable us to have the educations that we've had. I also would be remiss, they're not here today, but if I didn't thank my parents, Kalathur Narasimhan and Geeta Narasimhan. My father came from the National Chemical Laboratories, where he did his PhD in Pune. My mother is a nuclear engineer. Here they were with me when I received the National Academy of Medicine induction, the highest honor in U.S. medicine. I again would be nowhere without such wonderful parents who prioritized me and my siblings over everything else. Came again from very humble environments here in India. And so a big thank you to both of them as well. And lastly, my wife and children, who also are not here, but without whom I would be nowhere as well. My wife is my life coach, my best friend, somebody I think without whom I would surely not be in the place that I am. And I have two incredible boys, Kabir and Sai, who speak fluent German or learning French. Unfortunately, no Hindi or Tamil at the moment, but we'll work on that in the future. But a big thank you to them as well. So I wanted to now turn to reimagining medicine and talk about four trends I see fundamentally shaping the future of our sector. The first is, what is a therapeutic, and the long arc of history that medicine has had and where I believe it will head in the future. If you go back in time, for most of human history, we had no medicine. We believed that life was shaped by spirits, was shaped by the gods. It was really only in the late 1800s we began to discover that chemicals could shape human life, that chemistry could shape human biology. And it was from that setting that we had the birth of the modern pharmaceutical industry. Modern pharmaceutical industry, of course, grew over the 1900s, and with it, life expectancy grew as well, from under 40 years of age to now today to 80 to 90 years of age. Along that time period, we moved from the world of chemistry and chemicals to then biologicals, larger molecules, proteins, which of course are produced here in India, in Bangalore, and in Hyderabad. These biologics in the late 1980s really created a new revolution in how we tackle human disease. Today we enter a new era. We enter a new era where we can actually shape the genome. We can use cell and gene therapies to tackle some of the most difficult conditions that currently affect humanity. This is one of our centers at Novartis in Switzerland that is involved in cell therapies. You can see the technicians here. These technicians are involved in taking human cells out of cancer patients, reprogramming those cells, and then in many cases leading to remarkable improvements in these patients' cancers. This is the future of medicine, and I think now increasingly companies in our sector have to carry the full range. We have to be about cardiovascular disease, malaria, pulmonary diseases that of course afflict hundreds of millions of patients all around the world. And I'm proud that Novartis continues our hard work in those conditions. But we also are now going to have to be able to tackle the new world of cell and gene therapies, RNA therapies, and similar technologies which open up the horizon for how we can treat human condition and improve human life. The fundamental goal, of course, is to keep bending the curve of life. How do we keep increasing life expectancy, healthy life expectancy on this planet? And with the power of technology, we have the ability to do that. There is no better time to be alive than this moment when science-based technology is creating so much for human life. Now, at the same time, fundamentally, we have a significant challenge in the world of access. And how do we create access to these medicines? And I think that's the second revolution happening right now in our industry. When you look at it historically, companies like ours were primarily involved in drug donation programs. We donated medicines for conditions like leprosy. Novartis donates the global supply of leprosy medicines. Today, we continue to be deeply involved in leprosy control across India. But increasingly what we see now is the goal has to be to provide access to the latest innovations. We do that in our company by our commitment to ensuring that any novel drug we discover is licensed in a low and middle income country within 3 months of it being licensed in the US and Europe, that we make these novel medicines available. We do that in India through our work with access brands, our emerging market brands, which now enable us to bring the latest heart failure medicines, the latest medicines in dermatology, in neuroscience, to patients across India at scale. So we continue to believe as a company, and I believe we have to be about as an industry, how do we bring the latest innovations? I can tell you I had the opportunity to speak to the Gates Foundation and Bill Gates, and in his mind as well, as much as the challenge to find the next breakthroughs in malaria or in tuberculosis, we have to figure out how to bring these cell and gene therapies I just told you to populations all around the world. We have the power, of course, to transform lives in all corners of the planet. I believe access to medicines will be a big part, a really important part of that journey. And India will play an incredibly important role. I can tell you at our Hyderabad Center, we have dedicated teams working on leprosy, working, of course, with our teams in Mumbai on sickle cell disease. For people who aren't aware, there's more sickle cell patients in India than in any other country in the world. So we have to be about bringing the innovation to those patients as well. Now, the third revolution I'll talk about is maybe one you may have heard about. You may have heard about Unboss. We're trying to unboss Novartis. We're trying to create an inspired, curious, and unbossed culture. And this is also part of a broader transformation, I believe, that's happening in corporations all around the world. When you think about management theory really came about in the early 1900s when Frederick Taylor was running for Ford Motor Company, large manufacturing plants. Over that time, we developed things like organizational charts and managerial KPIs. People were fundamentally cogs in a big machine to create output. We believed that human beings were motivated by carrots and sticks. If we incent human beings, they will continue to produce more. If we punish for behaviors we don't want, then of course they won't do those behaviors. And that's how modern managerial theory was built. We were thinking about managers. What I find absolutely fascinating is when you want to look for books about leadership, about what does it mean to lead others, you have to go back to Eastern thought. The books I often prescribe are the Tao Te Ching and the Bhagavad Gita, where you actually learn about what is servant leadership. And the reason that becomes so important today is now companies like ours are filled with knowledge workers that are fundamentally motivated by being inspired by a sense of purpose, believing in curiosity and growing their own minds and learning, and having a sense of autonomy and ownership, an unbossed mindset. That is the future of work. And the faster companies can embrace that shift, the more their knowledge workers will be able to solve the problems. In fact, a boss is not a boss at Novartis anymore. You're an unboss. We like to tell our bosses you're not at the top of the pyramid, you're at the bottom. And your job is to remove obstacles for these incredible young people that you see on the screen here. This is our Novartis contingent at One Young World. Now, just to show you what I see in a big company like Novartis, I thought I would just share a 1-minute video on some of the images from my 2 years now as CEO. I think what we have to believe is fundamentally that people drive performance, that cultures drive performance. People often ask me, what is the legacy you want to leave at Novartis? The most important legacy I think I could possibly leave is creating this culture of inspired, curious, and unbossed so that a new generation of leaders can create the next wave of innovations that transform health around the world. We believe it deeply. We lead with it in every one of our discussions with our company, and we hope we'll be able to show the world, show the corporate world at least, by investing deeply in your people, you can generate incredible performance. Now, the last transformation I want to say a word about is the transformation of digital technologies. This is a picture from one of our centers where we monitor 550 clinical trials at Novartis in real time. We call it the Sense platform. The transformation of data science and digital in companies in healthcare, I think, is now reaching a tipping point. Our ability to organize and harness data sets at scale, to use those data sets, whether it's internal or external, to improve our operations, improve how we run our business, find new medicines, find new patient populations, and fundamentally improve human health, is happening at a blistering pace. We believe that ultimately we have to be a data science company. That's why we call ourselves a leading medicine and data science company. That data science is going to really shape, we believe, the future of our company. It's with great pride that I actually can announce to you today that as part of that journey, we launched 2 major initiatives today at our Hyderabad site. The first is the Novartis Biome of Hyderabad. Novartis Biome is our effort to engage the startup community around the world to take on problems that matter for healthcare. So I'd like to please say a round of applause for our Novartis Biome team, which will be now bringing the engagement with startups. I see many of the colleagues here, and a big congratulations to all of you. We have Novartis Biomes in San Francisco, in Paris, in London, and now in Hyderabad. It's because we see the tech ecosystem here to be truly world-class, and we believe by engaging with that tech ecosystem, we'll have the opportunity to transform our company. We also launched a new effort here as well called Novartis Business Services X, NBSX, another exciting initiative that's again based out of Hyderabad that will enable us to again transform our operations. Now, one exciting example I just wanted to share, because I think it shows the power of how technology can transform access to medicine, is the story of Zipline. Zipline is a drone company. It's a drone company that currently operates across multiple countries in Africa. With their drones, they're able to supply large quantities of medicines to various villages in far places, including blood, including vaccines, including medicines. We're partnering with Zipline in Ghana to bring our medicines to a vast region across the country. And here's just a brief video to show you what we're up to. Wow. So it's a short video, but just to give you a sense, that clinic that the drone reached with the medicine is in a place not accessible by road in the Lake Volta region in Ghana. With these drones now, we can move 1 ton of medicines a day around Ghana, enabling entire populations to receive access to medicines they just did not have access to before. So I hope it's just an inspiring story to show all of us what technology can do to transform human life and transform access to medicine. I did want to close with a big thank you and to really show here in Hyderabad what we've been able to build with great partnership with the government, a tremendous partnership with the ecosystem here. Today in Novartis, we have over 6,000 associates in Hyderabad, over 8,000 in India. India has become our 3rd largest location globally. We not only do business process outsourcing here, we have moved well beyond that since our efforts started in 2008 to move across the entire business value chain of our company. Whether it's R&D operations, whether it's business services, whether it's IT, whether it's digital, whether it's our chemistry, whether it's our manufacturing. We do it from here. Hyderabad has become one of the most important hearts of Novartis. And just to give you a feel of our Hyderabad site, another short video to give you a sense. Another use of a drone as well, so we use it for photography also. But I hope that gives you a feel. I mean, Hyderabad has, again, it continues to wow us at Novartis. Our leadership team tries to come here as often as we can for a jolt of energy, of innovation, of young minds, and so we're incredibly proud of this site. So, and maybe I'll just close with a few perspectives. I believe if you think about the minds that exist in India, the power of India to transform biotechnology, transform human health around the world goes far beyond its borders. Centers like Hyderabad and others around the country are able to shape human health around the planet. And I believe now India is entering a pivotal moment where its ability to improve its own health will increase exponentially. I think continuing to create a powerful innovation ecosystem where companies like ours can thrive, doing tremendous programs like Ayushman Bharat to enable access to medicine and access to healthcare for 500 million people around the country. I believe now India has the opportunity to become a global powerhouse in our industry and global healthcare, but most important to me is continuing to improve the health of the over 1 billion Indians that the country serves. I'm again deeply honored to have this award bestowed upon me. I thank the organizers, I thank all of you for listening, and I'll look forward to the panel, and I wish you a great event.
Thank you, Vas, for inspiring us again. And I'm sure all of us are unbossed. may I request you to kindly remain on stage. And to kickstart the CO Conclave proceedings, I would request Honorable Minister, both the ministers to come up on stage. Jan, if I could request you to go up on stage. Shri Dilip Bhai.
I say, okay. Thank you.
Mr. Dilip Sangvi, Mr. Ajay Piramal, Mr. Satish Reddy.
So thank you for that amazingly perceptive, amazingly lucid presentation. Thank you so much. And thank you for the kind words about Hyderabad and what you guys do here. And also, I think what really deserves a huge round of applause is the fact that Novartis' Biome, first in Asia, is being set up in Hyderabad. Thank you very much for that. And thank you for your continued endorsement. Honorable Minister, thank you so much, sir, for taking the time out and joining us. You've been a great supporter of the business at large in India, but the pharma industry, the life sciences industry, in fact, Hyderabad today, sir, just to bring you up to speed on the event, this is our 17th BioAsia 2020, and the theme of BioAsia now for this year is today for tomorrow. So if we have to use today and if we have to talk about today for tomorrow, let me start with a leading question and let me ask you quickly. Honorable Prime Minister talks about a 5 trillion economy by 2025. What do you believe for the life sciences sector, for the pharmaceutical industry, for the biotech industry, for medical devices industry in this country? What do you believe, what is the plan of Government of India to reach that 5 trillion economy? And specifically with respect to life sciences sector, if you could please bring us up to speed.
Thank you very much, Ramarao Garu, and compliments to you for organizing this 17th conference to promote this end of the science and technology vision of the country in such a grand manner, befitting Hyderabad as a destination for the pharma, biosciences and innovation industry. And that was truly a very inspiring address. Mr. Ramarao, the $5 trillion economy also has as its leg a very important component of happiness of the people of India. And I think while we can calculate all the numbers around the pharma industry, we can discuss that it's a $40 billion industry, possibly rapidly growing and scaling up to a $100 billion industry soon. We can talk of all the wonderful work that's happening in the sector. But I think the importance of this area of work cannot be ignored for its contribution to a better life, to a better future for the people of India. As Mr. Narasimhan very rightly pointed out, innovation can't be seen only in the context of change or only in the context of, at times as people worry, a threat. I think innovation provides you an opportunity to reach out to the remotest corners of the country, to all the people that we saw in some of the videos yearning for a better quality of life, for better health care, for longer life expectancy and a healthier life. And in that sense, the $5 trillion economy will be incomplete if our people don't have that quality of life, if we are not able to provide affordable health care to every single citizen of the country. And certainly what's happening in Hyderabad, with the presence of so many large giants in the space of innovation, biosciences, research, development, also augurs well for creating that cutting-edge technology into the country, introducing cutting-edge technology and imbibing in our youth that inquisitiveness that's necessary for a fast-growing economy, that's necessary for our youngsters to really evolve themselves, engage with the rest of the world. I'm glad that Hyderabad is playing an important role in that. You are attracting talent from within the country, from international companies. You're able to add new dimensions to the pharma sector. I think it's time we re-looked at the entire sector to see what would be the next level of engagement with the world, with international technologies, with research in the country. And I'm very sure with the kind of support, with the kind of engagement and involvement you've been able to bring up in this very important convention will help us redefine the future of the pharma and biosciences sector. I would urge all of you in the course of your discussions to come up with ideas, come up with suggestions on what we could do next to really make this sector thrive, to make it grow faster. Of course, even in a slowing world economy, I'm glad that the sector is doing well in India. I hear that you're growing at about 10% even during the current year. I just hope coronavirus doesn't land up creating a bottleneck in these ambitious plans that you have. But again, that will also possibly throw up some new opportunities for the sector to solve that problem also. But all in all, I think this sector in terms of numbers will of course play an important role both directly and through the ecosystem you create. But more importantly, will add that dimension which is a must for a country which is aspiring at the first stage to be a $5 trillion economy. But as I have studied across the world, economies, once they reach the $3,500–4,000 per capita level, which a $5 trillion economy will mean, they really are at the cusp of a takeoff, where one can then aspire to go into $10 and $20 trillion economies. So I'm sure this sector is going to be at the forefront of our ambitions for India, and I wish this sector well. I wish Hyderabad well in the days and years to come.
Thank you, Piyush ji. Let me just quickly follow up with one question, sir. So you talked about how big a role Indian pharma industry has played in terms of the Make in India campaign. In fact, they've been one of the foremost manufacturers, so to speak, from the industry's perspective, from the Indian industry's perspective. Pharma industry especially has been a hugely successful story. They manufacture, they ship across the world, and they also supply a great deal of medicines to the rest of the country as well. But in my discussions with them over the course of last couple of years, they pointed out three things. You mentioned China, and you mentioned potential opportunities that could arise from what's happening in China now. So one of the things I believe India has to do, particularly from industry perspective, is we have to operate and we have to leverage economies of scale. Unfortunately, there does not seem to be a policy on large industrial parks. For example, Telangana, in fact, has a proposal, and I've shared this with you in the past, for the world's largest pharma cluster called as the Hyderabad Pharma City. Unless we compete on scale, unless we manufacture on scale, I don't think we'll be able to compete with China or even Cambodia and Philippines, who seem to be leveraging the opportunity in China today. The reason why I ask this is, we've heard Honorable Prime Minister and yourself also talk about making in India. Making in India is of course important, and we have to leverage scale. But I think discovering in India is equally important. Research and development is important, but we hear that the weighted average reductions, which were at 200%, are now have been reduced to 150, and eventually after March, it will be at 100%, which is, I don't think, helping the cause of R&D. I think this will decelerate the investments in R&D. What's your thought on this, sir?
Well, I think income tax breaks obviously do help in encouraging and attracting investment. But that's not the only factor that determines whether an industry will come to a country, whether an industry will flourish in a country or not. One must recognize that there are several dimensions to India. And we were both together at Davos. You may recall that we had talked in Davos about the power of India being defined as the power of democracy, as the power of demography, as the power of talent, as the power of leadership, all of which culminates in the power of opportunity. And I believe that India is an opportunity which provides a huge market, 1.3 billion people aspiring for a better quality of life. We have a huge amount of talent, large pool of skilled manpower, very, very enthusiastic, well-trained, and I would say innovative thinkers from all across the country, a large number of them coming from this region. We have a leadership which is willing to take bold and strong decisions at the center, in the states. We have a situation where we would have the world's largest proportion of working age people, almost more than 50% of our population would be in the working age in the next 3 years. And that situation will continue for nearly 3 decades. Now, all of these are advantages which need to be leveraged, which will be leveraged, will provide opportunities. And I think working in a country where there is a rule of law, working in a country where there is justice available, working in a country where there is a domestic market potential which is huge, which provides the economies of scale in terms of market, is itself a value proposition which, whether it's China or Cambodia or Philippines, none of them can offer in this holistic a manner as India can. Tax breaks, of course, are a matter what one can discuss, one can talk to the industry and understand what needs to be done. But more importantly, I think we need to de-bottleneck the day-to-day constraints, if any, that industry has. And one which I can share with you is an area of concern at the center also. We recently had a meeting of the Council of Scientific and Industrial Research, CSIR, and during the course of the discussions, the Prime Minister did talk about finding solutions to make clinical trials more robust, more easy to operate and easy to implement in the country. Something which Mrs. Swati Piramal, had talked to me many years ago about. And I think the Prime Minister is very, very keen that that's an area which we need to address. And such areas that the industry may be facing, we would urge all of you to come up with your requests or your asks on a more practical or a more technical framework. Income tax and these breaks are always valuable, but certainly are not the end of the tunnel. It's not the end of the road. It's at best an enabler. Let's draw a larger line in front of the income tax break rather than struggling and remaining restricted only around that issue.
All right, sir. I'll have one quick question for you, and then we'll move on to other panelists here. Sir, I think in my discussions again with the industry over the last couple of days, one of the other things, very important things that came up, especially in industry like the pharma industry, they spend billions of dollars in research and development. And in India, when it comes to IP and enforcing IP, the gray areas between that emanate from the fact that the state and the center sometimes seem a bit disjointed and disconnected, apparently is also hurting further investments from coming into R&D. How do you see Government of India, in fact, addressing this issue?
In what way does the state come into the picture?
Well, the central, of course, the DCGI, in fact, works with the investor or the industry to, confer IP, and then the state actually gives the authority or the permission to manufacture. So when this is disjointed and when somebody, in fact, the gentleman who spoke to me said he had 30 infringement, IP infringement cases filed in the last few years, so which is a huge number. Yeah. And this is one organization.
Well, I know that the IP department has been trying to reorient itself. And when I was doing the review of the department about a couple of months ago, the numbers that they shared with me in terms of their ramping up their own operations, the speed with which they are able to give out patents or copyright licenses, trademarks, has significantly been ramped up. And my own direction to the IP offices that we'll have to look at ensuring that all applications get cleared faster than anywhere else in the world. And that's the effort on which we are moving in terms of the speed of action for any request that the industry makes to the IP office. In terms of infringement, what I believe is the industry would like us to give out more information in the public domain about the patents that are registered. And I think there are two schools of thought. There is, of course, the issue of infringement, but on the other hand, there is the concerns around evergreening of patents. And what I was explaining was that this is something which is contraindicatory to each other. And it's still an area where we've not yet come to an ideal world situation. But I've had some engagement with pharma industry. Mr. Sanghvi also met me and shared some of his thoughts about what should be done to reconcile these two issues. But with an open mind, we are willing to engage with the industry. We are willing to talk to the states. In fact, as recently as yesterday, I have proposed to the Department for Promoting Industry and Internal Trade, DPIIT, that we should look at a framework in which the states and the center come to a legally binding agreement amongst themselves to work as partners, to work in support of each other in the promotion of industry so that industry can get a stable, simple, and a predictable regulatory framework. And any state which infringes on that, or which does not uphold the sanctity of contracts or sanctity of any of these patent infringements, for example, or commitments made by one government being changed by another government or contested by another government, I think these are areas that the center is taking very seriously. And we will have to have some kind of a reward or penalty mechanism even between the center and states, so that the image of India as a country can be maintained and the respect that India enjoys today worldwide should not be harmed by the actions of one or two delinquent states at any point of time. But I accept your point that we will have to ensure that such patent infringements are taken to task very seriously, very quickly, and the center and states will all have to work together on this.
So thank you very much. Thank you very much for that elaborate answer, sir. Vas, what we saw in the video there, the grandfather goes to Basel as an intern, and the prodigal grandson returns to be the CEO of Novartis. Nothing less than a Bollywood movie, yeah? Nothing short of a Bollywood movie plot. Congratulations on all the success. We are absolutely proud and thrilled to have you leading Novartis in the world and putting India in the world map. So many, many congratulations. A big round of applause for Vas. Vas, let me quickly ask you a question. I know you're big on convergence of different spheres of industry. Hyderabad is hub, not just for Novartis. This is not just Novartis' second largest office in the world, but Hyderabad is also home to Amazon, Facebook, Apple, Google, Microsoft, Uber, Salesforce, ServiceNow. All of their second largest offices in the world today are right here. I know you're big on convergence. So this whole sphere of IT and life sciences, I know you also have entered this amazing sphere of digital drug discovery. Can you tell us a bit more about the opportunities this convergence presents? Because the world is evolving every day. We would like to hear from you.
Yes, and thank you, and thank you again for the kind words. Hyderabad is extraordinary, and having visited here since, in some form or another, since 2009, seeing how the ecosystem around our campus has exploded has been extraordinary. So now, of course, we see all of the sectors, but particularly the tech sector. And what we see is a few different areas where we believe technology will transform a company like Novartis, but also the entire sector. The first is just in how we operate. When you look at companies like ours, multinational companies, we operate in 150 countries, 108,000 people. Whether it's in how we run our clinical trials and how we can use machine learning, predictive analytics to run large-scale operations around the world, whether it's in our manufacturing centers where we can now increasingly use AI to better optimize our supply chains and optimize our manufacturing. We have sales representatives, 10,000 sales representatives who have an AI-generated insight given to them every morning on how to spend their day. We even have built in Hyderabad procurement engines that help us better spend the $16 billion we spend every year. So transforming our own operations is going to be significant, and we do that through partnerships. We have a significant partnership with Amazon, we have a significant partnership with Microsoft, and a range of other partnerships. The second big trend that will happen or is already happening is how do we mine the large data sets in healthcare? And those data sets, I think the best understood use case is mining medical images. So medical images, whether they're x-rays, scans of the retina, CT scans, and how you can use those scans to better diagnose disease, hopefully find different patient populations. That's one very significant use case. But we see many others. When you mine large data sets, can you better understand which patients might go into heart failure decompensation, or which patients might have a flare of their rheumatological illness? Clearly, those data sets are going to be very important. Some countries are very advanced. We work with Tencent in China on a major partnership in heart failure. We just announced a major partnership with the UK government to look at how to use large-scale data sets in cholesterol lowering as well. So these things are happening. I believe in the next 10 years, those data sets will rapidly transform how we diagnose and manage patients. The big unknown is, can you use AI to better understand human biology? And there are companies actually here in Hyderabad working on it. But sometimes we underestimate how magical it is we find any medicines at all. I like to tell audiences that in the history of the US FDA, it's only approved 100 years. It's only approved about 1,500 medicines. There's only about 600 validated drug targets we've ever found. This is an industry that spends about $175 to $200 billion a year in R&D. And we're lucky if we find 20 new medicines in the whole world in a year. And why is that? It's because in the human body, you have 40 trillion cells. Every cell has 1 trillion molecules, and the complexity is just vast. And there's so much we don't understand in the 4 billion years of evolution that's in every one of us. So that's the big opportunity. Can we use AI to find new drugs that we would have never found before? That's the hope. We're investing in it. Many great companies here in India are investing in it. And if we could use that AI combined with scientific human ingenuity to find drugs we wouldn't have found before, maybe double the number of new medicines we find, that would, of course, be a huge, huge breakthrough.
Fascinating, fascinating. We look forward to the day when we have more happening in AI with Novartis, with Biome, and with all the cool things that you're doing here. Jan, you heard the Honorable Minister. You heard him clearly, and his commitment to IP, his commitment to ensuring that we have more and more happening in your sphere of work. The one thing I wanted to ask you, in fact, the city that you sit in right now is not only home to India's 35% of Indian pharmaceuticals being produced from here, we are also the vaccine capital of the world. In fact, 35% of global vaccines are produced from Hyderabad, but we are greedy. We want more. So how do we get a company like Merck to come into India, to look at manufacturing opportunities, to look at doing more here? What do you say are the 1, 2, and 3 mission critical things to the Honorable Minister and myself on making this happen? I want to put you in the spot here.
Thanks for a great question. Honorable Ministers, I'd like to go back to Minister Goyal, who said that what we are really all trying to do is to think about having people here that are healthy, because we know that when people in India are healthy, that they will be productive and that you will create wealth. And actually the coronavirus outbreak in China right now clearly demonstrates that. Now, the best impact by far that you can have on human health is vaccination. It's prevention of disease. And so what many of the leading companies continuously are doing is continuing to strive to, on the one hand, develop new vaccines, and on the other hand, to make sure that we have enough supply for the diseases that need these vaccines. What we're looking for in countries across the world is really a mix. On the one hand, we're looking for a local market where there is actually a remuneration of all of the effort that companies have done to bring these vaccines to the market. And of course, that's going to be very different by country depending on the macroeconomic conditions of the country, but you're seeking for some form of remuneration. Secondly, the easier the regulatory framework, the better, the more achievable it is for us to deliver vaccines. To give you an example, many vaccines today are in short supply across the world, and sometimes we find ourselves in a situation that a certain country that had asked for a vaccine may not need to supply, and we want to deliver that to the country next door. And because of regulatory barriers, it's very, very difficult to do that. So how can we make it as easy as possible from a regulatory point of view? And then, of course, last but not least, this element of intellectual property. How do we make sure that also vaccines that will be invented in India are kind of protected in the right way? So with that, I know India, with more than 1 billion people, will be, incredibly important for all of us, both from making a difference for the people that need the vaccines, as well as in terms of the business. It's a real win-win.
I completely endorse your opinion on immunization and vaccines. But let me quickly also ask you, what's your view on price control? What's your view on making sure that the medicine is affordable and also accessible, and therefore some sort of regulatory measures that are brought in by governments and price control? What's your view on that?
Yeah, I mean, affordability is a word that we hear across the world everywhere these days. Even in the US, the word affordability is used on a continuous basis. I actually prefer the word access. And access is really multifaceted. It starts with making sure that you have the right healthcare system in place that diagnoses people, that you then have the right treatment with the right facilities, and that you also have the right follow-up. Of course, as an industry, we need to think about the differences between a country like India versus a country like the United States in terms of how we set responsible pricing. However, again, it's a fallacy to think that it's all about price. And let me give you one very specific Indian example. In India, half of all the women suffer from anemia. Yes. Now, you have drugs to treat iron deficiency that cost only 1 to 2 rupees a day. So this is not a question of price. So what we all should be focusing on to make a difference for the people of India is access. How do we ensure that people have access through diagnosis, treatment, and the appropriate follow-up and medication?
Thank you. Thank you. And Dilip Bhai, let me quickly bring you into the discussion. Indian pharma industry and its success. We've largely relied on generics, in the last few decades. Now, you have the Union Commerce Minister here. What would you want Government of India and state governments in India to do so that we have Indian pharma industry also move up the product value chain and start looking at more opportunities in R&D, start discovering our own molecules? I know Vas said only 20 of them get discovered, even though you spend billions of dollars, but still, I think it's a chance worth taking. So, what is it that you would want to tell the Honorable Minister and myself and to the audience that are watching us? What can Indian industry do to move up the product value chain? What is it that the government should be doing?
I think you've raised a very important issue at the stage at which our industry is right now. If I see globally, Indian companies are an important player in the generic business, but that's a relatively small subset of the total global business. Even though in the US and in
Dilip, can you please move the mic close to you, please?
Even in the US or other markets, more than 85% of the prescriptions are filled with generics, the value terms, it's a very small percentage of the global markets. And the challenge for Indian companies are a little bit different than what you would talk about for global companies. And that's what I think, if we have to transition from where we are to start participating in the innovative global business, then we will have to do a lot of things very differently from the way in which we've done in the past. Vas talked about close to $200 billion being spent in research every year. But if I look at, in India, companies would be spending less than 1.5% of that money. And because we don't spend as much money on innovation, there is not a single drug discovered in India which is yet in the global markets. So I would request Piyush Bhai to reconsider his thinking in terms of India is a great country and a very large market, but in terms of global market, we're still a very small market because the total business in India is around $20 billion, which would constitute maybe less than 2% of the global market. So how do we, generating revenue in India, participate in the global market, investing with large multinational companies so that we can compete? Because I think the picture that we see in front of us is that it's almost like what happens in Star Trek. You allow body to regenerate, you understand at biological and at cellular level what is happening. And that is true, and Indian companies are enabling technologies to reach there. But for Indian companies to invest in this kind of innovation will require an ecosystem to be developed, starting with that getting strengthened in our institutes. Because what I see when we are hiring people, technology for biologics is something that we need to strengthen. But as I see, we are gradually moving towards that, and maybe in next 5 years, at least Sun Pharma will have 1 or 2 innovative products, and maybe a few other companies will also have products in market. And as we start participating in the global market and generate revenues which will allow us to invest what is required to compete globally, I think we will be able to grow. But first of all, I think our major problem is access to high quality, affordable medicine for more than 1 billion people that we have in this country. And for that, what I think is required is technology which will allow us to produce high cost products, say like modular sterile technology, so that you don't need to sustain very high cost aseptic manufacturing facilities, or continuous manufacturing so that we can reduce costs of operation as well as manufacturing costs. So I think we have multiple options, but I think our industry has done very well in the past in terms of learning from others and continuously evolving, and we will continue to evolve.
Thank you, Dilip Bhai. Let me just, Mr. Piramal, I'll just come to you in a minute. I'll quickly go to Satish and come to you. Satish, you're not only the chairman of Reddy Labs, you're also now at the head of Indian Pharmaceutical Alliance. So please tell the Honorable Minister and the audience, what do you think are the top three challenges that the Indian industry is facing today? Minister talked about a couple of things which may have been music to your ears. Clinical trials, the discussion that he had with the Honorable Prime Minister. He also talked about drawing a bigger line and not just looking at the fiscal incentives possibly, and maybe he has something up his sleeve which we don't know about. Maybe he'll share it with you in confidence, I don't know. But Satish, tell us the top 3 things the Indian industry from your perspective as the head of IPA?
Sure. So I think clearly, as Dilip has explained, we need to move to the next stage of value addition for the industry, which is moving from generics to innovation. I think it's very critical because sometimes it's also good to see from the past in terms of capabilities that India has. So does India have capability to discover drugs? Yes. They have launched products in the Indian market, but we still have a gap, which is that a product discovered in India has never reached the global market because it's risky, it's expensive, it needs a sustained level of investments where the returns are not going to be that easy. So once we are faced with the situation, our request to the Honorable Minister would be, although he pointed out that income tax incentives are not the way to go, one of the reasons why we feel it very strongly is also from an experience that we have had as a company, Dr. Reddy's, in the past. Way back in 1992, we were one of the first private sectors largely generating revenues from APIs and partly formulations in India. We invested into drug discovery. So that was the vision of our founder, Dr. Ranjit Reddy, at that point of time. And we proved the capabilities. By 97, 98, we in fact licensed a product to Novartis in the PPAR class of compounds. But then the whole class of compounds came under a cloud, and that's why we had to shelve it. So it's that risky. So even though company expanded, it was getting into other markets, making profits, it is not enough to sustain in terms of what we need to do. So especially when we look at things like tax incentives, all we are asking for is an extension, of the 200% exemptions which went down to 150%. If it comes down on April 1st to nothing, right? So it becomes that much more difficult for companies to take risks. So that's one key thing on why we keep asking for incentives. The second part, I think, is again looking at the current situation, right? Especially when it refers to APIs. Again, it's interesting to go back to what was our position maybe way back in the 90s or early 80s to 90s. We were one of the largest producers of major APIs in the world. We were actually supplying APIs to most of the markets until, say, if you see what happened in the 90s, we ceded the situation to China. And again, we can go into various reasons, economies of scale, the subsidies which China gave and all that. And then once again, if we go back to the situation at this point of time, the present situation, I think it presents a wonderful opportunity because of this crisis for us to get back into the game, keeping the long term in mind and also looking at something which is very important, which is competitiveness, right? So this is where I think Indians can again prove themselves. And here again, there is a requirement from the government also to step in to provide, like Honorable Minister KTR has said, that, if we have a large infrastructure, industrial park, like a pharmacy coming up, or any other clusters which we have across in India, if we give it that necessary impetus, that's something which can make a difference for a sustainable, long-term competitiveness for the API industry. Because again, all I'm saying in both the things that I've said so far is that we have the capability, we can be competitive, we have proved that in the past, except that we need that extra push from the government and also the extra sweetener so that we can get to the next step. The last three one, because you asked for three. The third one would clearly be about, this whole regulatory environment, right? So whether it concerns environmental clearances, which is applicable especially to API industry, where we find a lot of bottlenecks, both at the central level as well as the state level, more so at the state level, sometimes in some particular clusters. It requires a lot of time, to get the approvals.
Yes.
Right? So again, the regulation is good for a certain reason, but if it becomes so complicated and then it takes a lot of time, we are again losing that competitive edge. So that's something which we need to look at. And also I think when I also talk about the clearances, even the regulatory pathway, whether it's manufacturing license or things like that, I think these have to help us in the ease of doing business. So again, I would go back to the point saying competitiveness, right? So let's not lose this advantage. We had this big advantage. At this point of time, we need to get back to that. That would be my three things.
Thank you, Satish. Mr. Piramal, you heard Satish Reddy. He says cost-intensive business, cost-intensive industry, also combined with the fact that there is a long gestation for regulatory approvals. Therefore, we need incentives. And also, Satish talked about the fact that there's a huge opportunity, cost competitiveness, competitive advantage that India should not lose. You're witnessing what's happening in China and the consequences of industry trying to also move to different parts of the world and relocate. Now, let me ask you two things. Firstly, again, the same question that I asked Satish. What would you like to say to the Honorable Minister? in terms of 1, 2, 3 from the government of India. And secondly, I see the industry diversifying. I see a lot of you talking about biosimilars, OTCs. I know you have a huge plant here in Digwal, and then, I also know that you've announced expansion. You also promised me that you'll write me a fat check after the event today. I'm thankful to you for that. But sir, before we get to that, I'd like to hear from you on how can government support you with respect to these diversification efforts of yours, and also, more importantly, like I said, in ensuring India retains its cost competitive advantage.
With your permission, let me first comment a little bit on what Mr. Piyush Goyal said, that we need to move to the next level of engagement. I think if you look at the success of the Indian pharmaceutical industry, a lot of it was based on how we were able to supply generic formulations in the US. My own feeling is that this is now history. Because of the great competition, and what's happened in the US is that today there are just 3 or 4 big buyers in the US, and they're bringing down the cost so much that Indian companies are actually profitability is at a strain. So we need to move to the next level. And I believe that's where we need to move from generics to innovation. Innovation is a long process. You know that it will take years and years to go, at least 10, 15 years, and a lot of investment. So I thought we could do a sort of one step ahead in the sense that we do innovation, that we supply to innovative drugs for large companies or for companies which have patents. We manufacture them in India, we develop them in India, and that's how we come to learn how to do innovative products. So we talk about R&D, but if I have to be honest, most of us in India do D, not the R part of it. So how do we focus more on R is the second thing that I would say. So to get research, we need to create that ecosystem which some of my colleagues talked about. That ecosystem would mean something like your pharma city, where there is a lot of, you create that critical mass of people, of highly qualified people, they like to be attracted to the same place. I think we create more such centers. We create such centers in universities, and that's where I think the government needs to invest money in education. So it's not giving to a particular company, which I know this government is a little hesitant to do, but why can't we give it to universities and create centers of excellence in doing research? Development we are good at, but we are not good at research. We are good at chemistry, but we are not good at biology. So can we invest more in that? The minister talked about clinical trials. I think we used to have, we have one of the largest R&D facilities in India at a time, but we had to actually do all our trials abroad because there was not enough regulatory processes here. So can we streamline that? And now this has been one other thing, if I may ask the minister. These things have been going on for 10 years and we are still working on it. Why can't we, the world has moved ahead. Nobody is going to wait for us. So let's do a little more of that. Therefore we move, I think, from producing generic drugs to producing innovator drugs. If it's not even our own innovator drugs, can we do it for others? Actually, in our Digwal facility, we are doing innovative drugs for some of our customers, they're not ours. Can we do clinical trials, if not for us, at least world-class clinical trials for other companies so that we get the know-how and then move to the next level? So that's what I would say, that let's focus on that. I just want another quick thing, because the minister also spoke about happiness and access. I think that's so important, and what we are doing in Ayushman Bharat and what is being done in the aspirational districts, which the Prime Minister has identified as the 115 districts which are really behind, which are not as developed as the others. I'll just give you one example. We are working in this district in Araku, which is now in Andhra, which is a tribal district. Access to that district, it reminded me of what Vas said.
is that you go by a van for some time, then there's no road, you go by a two-wheeler, and then the final 10, 12 kilometers you go by road. You just walk there. But there, because of technology, we've been working on it for the last 8, 10 years, and now have brought down infant mortality and maternal mortality to global levels. So it is possible with the use of technology to do that. I think that's also the next level of engagement, as what the minister said. Suma.
Thank you, Mr. Piramal. Piyushji, you've heard from two leaders from global MNCs. You've heard from three industry captains, Indian MNCs. You've heard them loud and clear. Let me ask you one quick question. Affordability and price control. Do you really think our price control framework with respect to affordability has worked in India? And what are your thoughts on the specific issues that were raised by the industry?
Well, to address the issue of price control first, it's worked hugely in India. To the extent that when we look at the volumes in terms of people who have been able to get, if you look at two of the medical devices that we have introduced price control on, the knee implants and the heart stents, the volume of operations that are taking place in India have grown drastically. And very clearly a country with a $2,000 per capita income, there are millions of people who would love to get themselves treated should they have this problem, but were not able to afford it in the earlier times. And very often, and I personally, because of the discussions going on with the United States and with the pharma industry in the US, had an opportunity to discuss it with several doctors in government and in the private sector. Very clearly, things were not going well before price control was brought into these two medical devices. We had a situation where a product which came into the country at price X was delivered to the final patient at probably 3x and 4x for a variety of reasons, not necessarily blaming the supplier of the equipment, but there was a whole value chain or a misvalue chain, whatever you want to call it, which operated in between and added to costs phenomenal.
Sure.
About healthcare, one thing is very clear, that everybody desires to give the best to somebody who's very near and dear to him or her. And at that point of time, irrespective of the value add that a particular product would bring or a particular innovation would bring, the person is willing to pay an arm and a leg at that critical point of time. So you're going to look at the best and best of doctors. You're going to look at the best and best of equipment. Now, at times, it may be a very thin line between the best and the second best, but you won't like to compromise on that. And this was being misused, unfortunately. We had instances where, with a slight modification, and on that I think companies like Merck and Novartis and we in India can continue to engage and really find a middle path and find a solution to the problem. If they are willing to work in that spirit of accommodation, considering that this is a discussion between two unequal sets of people. On the one hand, we have large corporations, billions of dollars worth, sometimes trillions of dollars worth of corporations, working for profits in their framework in a world where they have large pockets to deal with, against a country which is trying or aspiring to reach healthcare to over 1 billion people who can't afford it at the price levels that are sought to be imposed on the country. So I think price controls are here to stay. They are needed in an emerging economy, in an economy which is trying to take healthcare to the vast masses. And very often I believe that we may not be able to take the knee implant which has a little more flexibility or a little better features, but at least we are able to make him walk at a price which is affordable to him, rather than have products which may be slightly better, but make the whole affordability game impossible to implement in India. So price controls, as far as price controls go, personally, I am convinced after a lot of engagement with the medical companies, the medical equipment suppliers and the doctors, that has been good for the country and it has helped us reach healthcare to the vast teeming masses who were earlier remaining untreated or just losing out on what should have been available at affordable costs. Some of the other suggestions are quite good. I understand the importance of tax breaks, Satish ji. They were given at a point of time when you were trying to attract a particular business segment to the country. For a variety of reasons, I think one must also accept that there will always be a sunset to every impetus given at one point of time. I think we'll all have to look and engage in more innovative ways than just be hung up or stuck on one issue. And I think the other different suggestions that came out, how can government be an enabler? How can government try to ease things up, as Dilip Bhai said, on the environmental approvals? How we can make it easier for you to get your campuses on ground? Can we leverage the large amounts of money that government or government companies spend also on R&D? Can we try and improve the interface between universities, industry and the government spending to get a bigger bang for every buck? Because after all, innovation activities in India also are more affordable than innovation activities in the other parts of the world. And we were looking at the CSIR funding. We spend about $750 million every year. And we were looking at the kind of outcomes that come out. And we thought that possibly if, instead of focusing on these small outcomes, if the CSIR funding coupled with all that the Ministry of Biotechnology, the Ministry of Science, the Ministry of Health, the various arms of government which are also working on R&D or different PSUs and industry could all get together, work with our academics, some of whom are truly brilliant, like we saw his grandfather and his father and their work in research. I think if all of these could be put together, we can get much bigger bang for every buck that we spend and actually become the preferred destination for innovation around the world. We need to have KTR market India a little more. He's very good at it.
Thank you, sir. Kind of you.
But I think he needs to go beyond Hyderabad. I mean, we've had a little overdose of Hyderabad in the course of the panel discussion.
Are you saying we should launch a national party or something?
No, we would welcome you to come in as a national party because right now there's a vacuum out there. Other than the Bharatiya Janata Party, I don't see any other party.
I actually thought, honestly, you know, he's such a, this is happening in such a congenial kind of atmosphere. I thought after hearing all the Indian industry captains, I thought Piyush would actually have a change of heart and would announce that he's sticking to that weighted average deductions. But unfortunately not. But I guess you still have time, sir, to announce if you want.
No, I think it's important that even if I was to make that announcement,
it should be in Parliament,
it
sir.
should be by the Honorable Finance Minister.
All right.
And it's her domain to be able to take a call of this. But I really don't think there's any intention at present to do any of those things. I think the budget is already out. It's known to all of us. We'll all have to put our heads together and see what we can do. As I said earlier, to look at better enablers than just being fixated on one thing. And to my mind, that's certainly not going to be the only driver or the driver which is going to help companies choose whether they come to India or no. Frankly, if somebody is only coming to India for the tax break,
no, it's just an
I
addition.
think
The value
it would be too much of a expectation.
नहीं तो ये सर आइसक्रीम पे वो क्या बोलते हैं सर ऊपर वाला लेयर हो जाएगा बस उसके अलावा कुछ नहीं. I think it's just a value add.
ये सरकार ऐसे छोटे चीजों पे ऊपर नहीं फोकस करती है. हम बड़ी चीजों पे फोकस करते हैं. तो हम चाहते हैं कि लोगों को आइसक्रीम
मिले.
सिर्फ वो ऊपर जो स्प्रिंकल किया जाता है टॉपिंग उसके ऊपर आप फोकस करना.
So, thank you, sir. Vaz, one quick question. You started, you launched CAR-T, Novartis launched CAR-T 2 years back in India. Where do you see India in the cell and gene therapy product value chain? How do you see this shaping up in India?
Yeah, and if I might, just one brief for me.
Are you going to talk about an ice cream and the topping too?
No, I have no more requests for the minister. Sure. But I do have an observation, which, when you look at it, India is remarkable when you look at innovation in areas like engineering, in IIT, and in device sector, materials, chemistry, and that's why I think the incredible success of the Indian generics industry, given outstanding, my father, I come from a family of chemists who did their PhDs all around India. But what there is very little of is fundamental human biology discoveries happening in Indian universities. When I reflect on it, you of course have major discoveries happening, not just in the US, but happening in Japan, in multiple countries in Europe. China has launched a massive policy to push their universities in biomedical research. I had the opportunity yesterday to speak to a large group of outstanding physicians from a range of different areas in India, and they pointed out to me that there isn't a culture of medical research in the universities and the university medical school. This was their perspective, that really prioritizes scientific discoveries in medicine. And you can spend as much as you want at the industry level. If you don't have universities making fundamental discoveries, you don't get the venture capitalists. And without the venture capitalists, you don't get the ecosystem. And without the ecosystem, you don't get the companies like us to show up. We are in many countries with our research, but we don't see that university push. And I think it must be possible here because it happens at the IITs. It happens in management theory at the IIMs. And so I think that's, and I don't know what the policy is, Honorable Minister, but there has to be a push if you want to really make drug discovery happen here. And then I think with respect to cell and gene therapies, this of course, as I said, is a significant transformation. I would say first in India, our focus is to continue to provide access to the broad range of medicines for the biggest causes of death and disability: cardiovascular disease, lung disease, infection, cancer. I mean, these are the big things that we still have to tackle. We're doing our part. We believe you can price effectively in India with our emerging market brands. Our team here is extremely successful. We reach millions of Indians with our most innovative medicines using tiered pricing strategies very effectively. So you can do it. Now, to get cell and gene therapies into the country first, there needs to be, I think, clarity on actually increasing the capacity of systems to handle these therapies. These require hospitals that have advanced capabilities. The country would then also need a rare disease framework. I mean, in a country, of course, that has so many big health problems, how it tackles rare diseases will be incredibly important. So developing a rare disease framework will be important for us to then understand how to bring these technologies in. And then we need globally to figure out how to make these very advanced therapies at scale. I mean, we can only make a few 10,000 doses, so we're not at the scale to tackle India or China. And then, of course, the costs have to come factors down to make them accessible. I believe it will happen in 5 to 10 years. I believe that will involve local manufacturing as well when this happens, when we get to the appropriate point in the journey. So I think it will come, but I think there's steps we're going to have to take.
You're far too politically correct than the two politicians on the stage, in case you haven't figured out it. But thanks, Vas. Thanks for that perspective. We have 5 minutes left, so we'll get an elevator pitch from each of you gentlemen to the Minister on what you would like to see different in India if it has to really shape up into a world-class research and development destination and also a top-notch, which it is already, manufacturing destination as well. So an elevator pitch, Jan, to the Minister in 60 seconds or 90 seconds on tops. What would you like to see differently in India?
So India has been an amazing legacy in chemical engineering, biotech engineering. I actually agree with the colleagues to focus on building a biotech industry. Look at countries around the world. What have they done? How have they built these academic hubs? What have they done in terms of easing the administrative burden and creating the incentives? And build on the strong legacy that you have. So that would be my recommendation.
Fantastic. Mr. Piramal? So 90 seconds only. So you have to do, you have to work like a startup.
Now, I think one big opportunity for India is to become a player in the sterile injectable space, but it requires a lot of coordination with various ministries, both at the center and the state. There's an acute shortage of sterile injectables. India is still not there. I think that's a huge opportunity for us, and if the minister and both of you combine together, we can do that.
Absolutely. Thank you, sir. Dilip Bhai, 90 seconds. What would you like to see Piyush ji and Government of India and state governments do differently to make you all thrive more and do well in India as an industry leader?
No, I think clearly if some of the restrictions under which, let's say, regulatory controls, they become simpler, and that will be in manufacturing, that will be in conducting research, that will be in conducting clinical trials. I think it will clearly facilitate rapid development of this capability. Lot of times we are behind other countries or other companies because it takes much longer for us to get permissions in India, and we are in active dialogue with government on these issues. There is a lot of appreciation of the challenge that we are facing, and we hope that many of these challenges we should be able to overcome.
Thank you. Satish, as the head of IPA, what are your final thoughts? 90 seconds.
I think a lot has already been said. I would only emphasize the point that the ecosystem that everyone of us has pointed out, especially when it concerns innovation, the confluence of what happens in the academic institutions, what happens in the industry, what happens in government research institutions, and also another point on the medical research, right? So all the confluence of all this, I think, can create a huge value. So if we find a way to incentivize the system, I'm not going to talk about tax again, but to incentivize the system so that it actually gets nurtured and takes India to the next level on the global stage. That's what I look for.
Thank you, Satish. And Piyush ji, final thoughts after hearing all of them again, and then we
I think it's been a fascinating conversation. In some sense, also a lot of food for thought for me to delve on as I get back to Delhi. But what I'm thinking is that sometime in the second week of March, I'll get together the pharma industry to spend a day with me, and let's dissect the various issues that are plaguing the industry. I heard all the different suggestions about what we could learn from the world examples, specific products like sterile injectables where India can, or there is a window of opportunity to take leadership, pole position, the ideas around creating faster approvals, getting the manufacturing, research, universities all together, and overall looking at a confluence of stakeholders, the ecosystem getting sharper, if I may use that word. I think all of these are good suggestions. I'm delighted to hear that Novartis, rather than focusing on the problem, is finding solutions in terms of emerging market teams, working for affordable medicines, reaching less developed or developing economies. And I think if we all stakeholders, be they the pharma industry, be it people who are involved in research, we could possibly also, in such an engagement, bring some of our top medical schools or universities and government organizations like CSIR on the table. I think if all of us sit down, put our heads together and spend some time, we can find solutions to all these issues that have come on the table, be they clinical trials, be there environmental concerns, be it issues around creating economies of scale or developing better clusters.
Absolutely.
For different heads, possibly manufacturing of medicine would be one, but medical devices could be another. And you have a medical devices
yes, a huge medical device
coming up in Telangana also.
It's already up.
We could look at developing certain truly empowered bodies which can look at faster dissemination of problems of the industry and work with center and the state together, or at least those states which are willing to be more proactive on this. And I'm sure solutions can be found to give that speed, give the whole industry a bigger, better, faster, brighter future. And in conclusion, clearly what Mr. Narasimhan, you just mentioned about inculcating the spirit of inquiry in our youngsters, the inquisitiveness to experiment, to go beyond the textbook, is something that is probably going to be the fulcrum to be able to create the rest of the environment around research, around innovation. Thank you very much for your suggestions, all the panelists. Thank you, Mr. Ramarao, for your putting us all together on this platform and for this very exciting journey that Telangana has embarked on to promote the pharma and the biotech industry in your state. I wish you well, I wish the state well, and I'm sure we can all work together for the future of this industry and work to take healthcare and medicine to 1.3 billion people at an affordable price, at the right time, with the best of quality and with the best of intentions.
Thank you so much, sir. In fact, I wish we had more time, but that's it from us. Thank you, Satish. Thank you, Dilip Bhai. Thank you, Vas. Thank you, Jan. Thank you, Mr. Piramal. And of course, to the Union Minister, sir, thank you for taking your time. Thank you for coming all the way from Delhi. And thank you for spending so much time with us. Thank you. A big round of applause to the panelists, please.
मोदी सरकार का महिला विरोधी चेहरा बेनकाब हुआ तथा भारतीय जनता पार्टी का महिलाओं के प्रति पूर्वाग्रह संपूर्णतया नकार दिया गया। सुप्रीम कोर्ट ने मोदी सरकार द्वारा महिलाओं को संपूर्ण आर्मी कमांड ना देने बारे, परमानेंट कमीशन न देने बारे, देश सेवा में सेना में लड़ाकू भूमिका न देने बारे, महिलाओं की शारीरिक भिन्नता और घरेलू दायित्वों के आधार पर फौज में बराबरी का दर्जा ना देने बारे और पुरुष सैनिकों के द्वारा महिलाओं के आदेश ना मानने बारे, इन सब कुतर्कों और दकियानूसी दलीलों को नकार दिया। सुप्रीम कोर्ट ने कहा कि मोदी सरकार को अपनी सोच और मानसिकता दोनों बदलने की जरूरत है। मोदी सरकार ने रक्षा मंत्रालय के माध्यम से 2019 में एक नई नीति भी बनाई थी, जिस नीति के तहत महिलाओं को परमानेंट कमीशन केवल स्टाफ पोस्टिंग में मिल सकता है, और जिस नीति के तहत अगर किसी ने 14 साल की महिला ने फौज में सर्विस की तो उसे परमानेंट कमीशन मिल ही नहीं सकता। सुप्रीम कोर्ट ने मोदी जी की 2019 की इस भेदभावपूर्ण और दकियानूसी नीति को भी सिरे से खारिज कर दिया। सुप्रीम कोर्ट के देश की बेटियों, देश की महिलाओं को परमानेंट कमीशन और लड़ाकू भूमिका तथा बराबरी के अधिकार के इस निर्णय का भारतीय राष्ट्रीय कांग्रेस स्वागत करती है।
झारखंड विकास मोर्चा की कल एक बैठक प्रदीप यादव जी के और माननीय बंधु तिर्की जी के नेतृत्व में झारखंड में हुई, जिसमें हजारों लोगों ने, जो वरिष्ठ पदाधिकारी थे और 3 ही सांसद हैं, जिसमें से 2 सांसद हमारे विधायक हैं जो हमारे साथ बैठे हैं, उन्होंने कर ये निर्णय लिया कि झारखंड विकास मोर्चा कांग्रेस में विलय करेगी। वो कांग्रेस अध्यक्षा ने स्वीकारा है। और जैसे कि आप सबको मालूम है कि हाल ही में जो झारखंड में चुनाव हुए थे